hand hygiene. Good afternoon, my name is Kelsey, I'm going to be your student nurse. Can you please state your name and your date of birth for me?
Alicia Prosperi, 2/12/95.
And can you state today's date?
11/18/15.
Okay, and where are you?
St. Francis Hospital
And why are you here?
for a physical exam.
Okay, Alicia is a 20-year-old female. She appears her stated age, and she is awake, alert, and oriented times 4. Okay. Her skin is pink with no signs of cyanosis. She is well nourished and well developed. Her position is erect and comfortable. She exhibits no obvious physical deformities. Her posture and position is erect. Could you please walk across the room for me? Okay, her gait is regular and steady. She appears to have well balanced. She exhibits no involuntary movements, and she has no range of motion difficulties. Okay, her facial expression is appropriate for the situation. She maintains eye contact and appears comfortable and cooperative. Her articulation is clear and understandable. Her speech is fluent English with an even tone of voice. She responds appropriately to questions. She is able to hear stated questions, and she appears clean and well versed. Okay, now I'm going to inspect your skin, your hair, and your nails. Can you please hold out your hands for me? Great. Her hands and fingers are well formed with the fingers intact, and she appears to have no clubbing or deformities on her nails. Her nail beds are pink, and her capillary refill occurs less than 2 seconds. Her hands are warm and dry to touch, and her hands are smooth, and they appear intact with no evidence of lesions or skin breakdown. Okay, I'm going to inspect her skin turgor, okay, and she has no appeared tenting. Okay, I'm going to inspect her head, okay? Do you feel any tenderness?
No tenderness.
Okay, her head is normocephalic and normal for her age. There's no appeared tenderness, redness, or flaky. Okay. Any tenderness?
No.
Okay, I palpated her sinuses and there's no appeared tenderness. Okay, I'm going to assess cranial nerve number 7. Can you smile for me? Can you frown? Can you puff your chin? Lift your eyebrows for me. Okay, her face is symmetric. Okay, I am now going to do cranial nerve number 2 with the confrontation test. Okay, can you cover your left eye for me? Tell me when you see the pen, okay?
I see it.
Okay, and can you cover the other eye for me? Same thing.
See it.
Okay, and her visual fields are intact by confrontation. Okay, I'm now going to assess cranial nerve 3, 4, and 6 with the cardinal positions of gaze. Okay. Now follow the pen with just your eyes, okay? Her ocular muscles are intact, okay? And her external structures, her eyebrows and her eyelashes appear normal. I'm going to inspect the internal eye now, okay? I'm going to do the pupillary light reflex. Okay, and alright, her pupils are, and I'm going to do one last accommodation, okay? Her pupils are equal, round, reactive to light and accommodation, and her sclera appears clear and white.
Good.
Okay, I'm going to assess your ear. Okay, do you feel any tenderness when I pull that?
No.
Her internal ear looks normal. There's no redness or no lesions present, no cerumen present. Let's see. Her nose. It is intact, no deviation, the septum is intact. Okay, and for, can I have you hold one nostril and breathe? The other nostril and breathe? Any difficulty?
No.
Okay, I'm going to have you open your mouth for me. Okay, the cheeks and the gums appear pink and moist. No obvious lesions or redness or dryness. Okay. I'm going to, let's see. Can I have you touch your tongue to the top of your mouth, please? Okay, the tongue is it extends in the midline. Okay, I'm going to assess cranial nerve 9. Can you please open your mouth for me and say ah?
Ah. Ah.
And the gag reflex is intact. Okay, and that is cranial nerve 10 by doing the gag reflex, and it was present. Okay, cranial nerve 12, can you please sit out your tongue for me? Okay, again, it protrudes in the midline, no tremors. Okay, and now I'm going to inspect your neck. Okay, it looks symmetric, no visible deformities or masses. Okay, I'm going to palpate the lymph nodes. Okay, and no palpable lymph nodes, any tenderness?
No.
No tenderness, okay. Now I'm going to palpate the carotid arteries one at a time. Okay, and here I would listen each side for a full minute. The pulses are +2, and they're present, +2 normal. Okay, I'm going to now listen for any release. Okay. Okay, and there's no bruise present. Alrighty, and the trachea appears in the midline. Alright, now I'm going to assess for jugular vein distension. I would have you lay down. I would have you come from supine up to a 30 to 45 degree angle. I would put the pen light on the side, and there's no jugular vein distension. Okay, can I have you, let's see, by assessing cranial nerve 11, I'm going to have you put your chin to your chest, and shrug your shoulders for me. Okay. Her neck is supple with full range of motion. Let's see, her arms, the extremities up here are symmetrical, dry skin. I'm going to have you push against my hand. Okay. Normal strength and resistance. And now I'm going to palpate both pararadial and brachial pulses. Okay. And here I would listen for a full minute. Okay. Okay, and they are both +2 bilaterally. And I will check capillary reflow. Again, less than 2 seconds. Okay, now I'm going to test cranial nerve number 8 by performing the whisper voice test. Okay, so I'm going to whisper 3 words behind your ear, and you're going to repeat them back to me. Okay. Monday, baseball, 18.
You said Monday, baseball, 18.
Perfect. To inspect the chest, the lungs, the thorax. And normally I would listen to the lungs, the breath sounds, and the heart sounds on a bare chest, but I'm going to go over those for this time. Okay, so her chest is symmetrical, no shallow or deep breaths. I am going to test the symmetric expansion. Okay, take a deep breath for me. Okay, and that is symmetric. I am going to run my finger down her spine. The spinous processes are all intact. Okay, I am going to listen to her breath sounds. Okay. Deep breaths for me. Her lungs are clear, no bronchi or rales present. Okay, and I'm going to test the costovertebral angle for any tenderness. Okay, let me know if you feel any tenderness when I press hard. Okay.
No tenderness.
Okay. Now you can face forward for me. I'm gonna listen to her lung sounds on the front side. Okay. anterior side, they're also clear, no adventitious breath cells. Also, by inspecting her chest, there are no lumps and there's no tenderness present. Now I'm going to listen to her heart sounds, so I would inspect the pericardium for any pulsations, and there's none present. Okay, I now will identify her, the area for her apical pulse, and I'll listen for a minute. Okay. Now I will identify the oscillatory areas, so the abdomen that we use, the aortic, pulmonic, Erb's point, tricuspid, and mitral, and I will listen for all the heart sounds, S1, S2, and any additional. She has no extra heart sounds present. Okay, now I'm going to assess the abdomen, so I'm going to have him lay down for me. Okay, so her contour is flat, her abdomen is symmetrical. The characteristics, the umbilicus, all is intact, there's no pulsations. I'm going to listen to your bowel sounds starting in the right lower quadrant. And she has normal bowel sounds present. Okay, now I'm going to inspect the femoral artery pulse, okay? And that is normal +2, okay? Easy to palpate. I will palpate the inguinal nodes. And there's none palpable, okay? Now I will inspect the pulses on her lower extremity, so I'll start with the popliteal. Okay, and that is +2 normal. Okay, check the right leg. That is also +2, so +2 bilaterally for the popliteal. Now I'm going to do the posterior tibial. Okay. Also +2. And bilaterally, so bilaterally +2. And lastly, the dorsalis pedis pulse. Okay, +2. Okay, so see, her skin on the legs is warm. There's no edema present. I would assess the capillary refill on her toes, and when I checked it, it was on her fingers. It was less than 2 seconds. Let's see. Now I'm going to test your range of motion. So I'm going to have you lift your right leg up, okay, and your left leg. Okay, and bend your right knee for me, and here do the same with the other one. And can you rotate your feet and the other one? Okay, so her range of motion is normal. Okay, and I'm gonna do a home inside to test for any DVTs. Okay, so if you feel any pain when I flex your foot, just let me know. Okay.
No pain.
Okay, and how about the other side?
No pain.
Okay, so she's negative for home inside, so no DVTs are present. Okay, lastly, let's see. Alright, you can sit up now. do sensation on her hands, arms, face, legs, and feet. Okay, so just let me know when you feel. Okay, and same for this side. The sensation is normal. Okay. Now I'm going to assess the Babinski reflex. So I would take okay, and her toes curl in as a normal response. Okay. Let's see. Now I'm going to perform a mini mental exam to assess her level of consciousness and orientation. Okay. Again, can you tell me today's date?
11/18/15.
Okay, and where you're at and why you're here?
I'm here for a physical exam. I'm in St. Francis Hospital.
Okay, she's awake, alert, and oriented times 4. Now I'm gonna give you 3 words, and I'm gonna have you remember them for me. Okay, and repeat them back. So ball, cat, red.
Ball, cat, red.
Okay, great. And I'm gonna. So she passed the mini mental exam, and her level of consciousness is good. So thank you very much for your time. Hey, Alicia, I'm gonna have you walk across the room for me.
Okay.
Can you walk heel to toe? All right, and then just come back. Okay, her gait is smooth and fluid. Can you please bend at your knees just one at a time? Okay, great. Now can you touch your toes for me? Okay, and can you lean back? Perfect. She has no weakness and she has full range of motion. Alright, Alicia, this concludes my assessment. Thank you for your time.